Hello again, everyone. Welcome to another episode of the Curacel and AI podcast. I have an amazing guest here with me today, and Dr. Uzezi, why don't you go ahead and introduce yourself to our audience?
Wow, good afternoon to everyone out there. Well, it's a pleasure being here. I'm by name Dr. Uzezi Akpotu. Um, you know, been practicing for quite a number of time now, so over 9 years to 10 years now. And I've gone really wide in the field of medicine, also to add with the health insurance aspect of medicine. Well, that's where I function presently, and it's been an exciting journey.
All right. Thank you again very much for that lovely and concise introduction. For those of you just meeting me for the first time, I'm Abdul Jabbar Momo, Head of Commercial here at Curacel, and I'll be your host for today. Dr. Uzezi, without further ado, I'll let you share a bit about, we're all curious, myself, the community. We want to hear about your journey, as a medical doctor and now as head of claims, at a prestigious health management organization. So how's that journey been for you? Maybe you could, spill some highlights and then also tell us some of the amazing work you're doing today.
Well, so far the journey has been, it's been a little rough, but again, exciting, like I would always say. Why do I say rough? Because existing in itself, I'm having to go through the challenges and hurdles of every race you run. Just tells you that you're going to encounter some obstacles. Well, so I graduated from the University of Jos, my early days back then from medical school, where I backed my degree, MBBS. Then I moved on from there. That's about 2015, 2016. I moved on from there and on to my primary internship in a city known as Lafia Kefi, Nasarawa State. Well, while I was there, Federal Medical Center was an exciting journey because I had to learn the basics of medicine, as the case may be. And then, so excitingly, I emerged as the best surgery house officer, also the most effective pediatric care house officer. So that tells you I love children a lot too.
Yeah.
And I was doing great in obstetrics and gynecology. So just along the line, one of my trainers saw me and he said, wow, I would like this vibrant doctor full of so much energy to run my hospital. So I started to work with him for about some years, 3 years thereabouts, in German Medical Center, where I grew to the rank to become in charge of the facility and also as the head of the HIV clinic and tuberculosis. So I functioned there, with so much experience, which I gathered over time, also improving my surgical skills, right? Because of course, as a general practitioner, you should know how to do certain basic operations because that's going to help when you're posted to rural areas. So I had the opportunity to also work with Nassau State government after my 3 years working there as the head of general hospitals there, the medical superintendent where, my period there was so much improvement because we took obstetrics from the common complications that we see in rural areas. We took it to a bit, dropped down the mortality rate by some percentage, by educating them, giving them medical educations on how to have safe obstetric practice. I moved on from there and then I thought so many persons were having it difficult, having to foot bills and all of that, paying out of pockets was a big challenge for people. And then it came to my understanding that the coverage for health insurance in Nigeria is not really that, we don't have a wide coverage anyway. So I thought to myself that I think it could be in a place where people could enlighten people and then be a driver of how to sell health insurance and ensure that, people know the importance that one day it's going to really help. So, I moved on while I was there. I had the opportunity to move to Lagos, which I embraced it because I've always looked forward to say, oh, wow, how do people have a better approach to health other than the usual pay out of pocket, which it's really not exciting per se because there are a lot of challenges for going through family fronts and all of that. Well, I had a lot of experience anyway where I was coming from because I know about the robust health insurance scheme, National Health Insurance Scheme or agency, in the facility there, so coming here, it was just improving on my wealth of information and knowledge. while I headed the medical and claims unit. So it's been a great journey. Having to be the head of medical and claims, you tend to see how you're more or less like, I like to use the word, you're the doctor's doctor. That's it. Yeah, you're the doctor's doctor. Why do I use that phrase? Because you tend to check the activities somehow, the activities of the medical practitioners, the hospitals in terms of providers. They are the health providers. So you tend to check the activities. You also want to ensure that the right codes are being authorized for. And then you want to ensure that the enrollees, who happen to be the patient or the clients in the picture now, get satisfied. Because one thing that was always key on my mind is quality assurance and patient-centered care. So I told myself that if this is the medium where I can drive it, no matter how little where I am, I can drive what I want to drive for. So it's been a lot of experience, in the claims processes, the medical attentions, and all of that so far.
Super inspired by your story because, again, just connecting the dots of, being a medical professional and then seeing a problem in your immediate community as to, people paying out of pocket not being sustainable and thinking there is a better way we could do this, and that even inspired the next phase of your journey. Yeah. Committing to say, how can I drive, more quality insurance products, inclusive healthcare? It gets me super excited because it resonates with everything we stand for at Curacel. So that is really great to see. My next question really was going to be around your day-to-day operations, right? Now that you are the doctor's doctor, right? What does your day look like? What is the day in the life of Dr. Uzezi like, administering those claims? How do you manage those processes today?
Okay, so well, I'll just go into a little of the claims processes itself. Of course, we know what the health insurance organization or the system is about. It's about sort of, purchasing policies. When you buy certain policy in form of premium, when they come in, you have coverage. I mean, you have benefits, that you have at your disposal, from routine consultations in hospitals, to service deliveries like what's it called, pregnancies and attendant deliveries, optical services, dental services, specialist services, and surgical or other surgical services. So we know we're in an endemic environment like Nigeria for malaria. So imagine paying out of pocket every time you get struck by malaria, right? That's really cumbersome. It's not ruling out the fact that the pharmaceutical now has gotten very high, and also cost of services also going high with inflation in the health industry right now. So this is where health insurance comes in very handy for people now, right? So now, what's the process? The process is, they assess care, right? They assess care, which are the providers, service providers in terms of the hospitals, the laboratories, or the pharmacies now. So when they assess care, right, their medical bills are now sent via to the hospital, to our facility, or sent to us from the providers. Now, when they get to us, we have a projection. We have an idea. Okay, these bills have come. We want to project the bills. After projecting these bills, at the same time, we also want to go through the claims processes by way of vetting these bills. Having vetted the bills, what are we checking? We want to ensure that every care given, right, is in line with standard practice. And somewhat there are no fictitious bills, right? Because we understand that even though we want to maintain quality assurance, we also have to be cost effective, because cost effective is also key in the process, right? You don't want to just pay for robust investigations that are not necessary. So for that reason, we have to vet these bills. When we vet these bills, some of these services require authorization code. So have you properly gone to the right channel to get the authorization code through a call or a mail to our call center? Now, if you have done that, we now look at this thing and say, okay, has it been well represented? Does the diagnosis match with investigation? Does it match with treatment and all of that? Are there things that the patients have not done or they have not done that you have included in your bills? Because there are cases where, an enrollee may decline either a blood transfusion, or an enrollee may decline an admission, but because a code has been given, they will represent the bill as an admission bill. Of course, that's not appropriate. That's not appropriate. So you need to vet it. So the claims officers, they do that process of vetting. Now, I haven't done that because there are no systems without mistakes or without flaws. You have to now recheck. There's always a check system. And this is where the head of claims and medicals come in. I will have to now review those claims and everything that have been vetted, step by step to ensure that everything is appropriate. Because everyone in business or something, even though you want to service health, you still need little cost to run the system because there are overhead costs to have staffs and all of that. You need to pay salaries. So you can't just be careless about how you disburse money. That's insurance anyway.
Yes.
So once that is done and everything is certified that it is okay, of course, there's always hierarchy and there's chain of commands. So this will now have to go to what? To the MD, ensuring that, okay, this has been approved and this is fine and all checks in place. And once approved, payments are made out to the various the various hospitals. Sometimes people can be aggrieved. They can feel bad about the fact, oh, wow, we got an authorization for this, but we were denied claims. So they can come in form of reconciliation to say, we want to contest what you have done so we can reconcile the differences. And when we go through the reconciliation process, everything is fine. We can also now pay because there are channels of avenue for reconciliations. And there are also what we call refunds too, because there are certain times that, some clients will have to pay out of their pockets, either because that service is not provided or they do not have hospital within their reach, that location. So they may have to pay out of pocket for certain things, which will refund back the funds they have spent. So it's a win-win for everyone. It's a win-win for everyone. The enrollees, they don't pay out of pocket any longer. And then the providers, their business, also the health insurance is also checking the system. So sometimes I get calls from doctors from the other side, and they're like, come on, why would you just sit over there and your claims officer has the better habits of stuff? By the time I begin to educate them and make them understand that, look, this is how this process works. They will come to terms and then we have the business running and everything is going smoothly. So basically, that's what it has been like in the medical claims. Not ignoring the fact that first, I'm a physician anyway. So we have cases where we need to go give health talk, health education, and all of that, create awareness, to our various companies who have bought policies or who have bought policies in terms of their purchase premium and all of that. So we keep that process ongoing. We also have our in-house doctors who also consult through telemedicine, and I happen to be one also to be consult through telemedicine. Of course, the world is going digital, so you don't want to be left behind. And then we're looking forward to seeing how we can use technology in a higher version to drive the processes, claims, because sometimes, there could be some delays and there are some, sort of, bottlenecks here and there. So that's what we're looking at further to see how we can be driven more by technology to get these processes easier than the way they are. But by and large, that's the process of claims.
In fact, I think this conversation is flowing just excellently well in the direction that I love, because I was going to talk about technology next. You mentioned a whole lot of processes and stakeholders. So there is the beneficiary or the client who, like myself, will take my health management card to the hospital to access care. And there is my dentist who will be providing that service and not asking me for a dime for my scaling and polishing. And when that is done, my dentist has to then reach out to Life Action Plus, to say, Mr. Abdul Jabbar is here for XYZ service. Should he go ahead? Or maybe after the service is done, can we get paid for it? And then you then have to double check on your end, right? Just breaking it down in layman terms.
Yeah.
Now, this is a whole process involving multiple stakeholders. And I believe, again, part of what keeps you in business is how do you make that process more effective? How do you keep your providers happy? How do you keep your enrollees, who are the patients, now happy, right? And how do you still ensure that you are running a cost-effective business, right? So what role has technology played in this process for you? How are you currently infusing technology to manage and optimize this process as of today?
Oh wow, that's a very key important question. I like that question. Now, we know what the claims process is. I mean, insurance generally, mostly the health insurance, what it's about. Now, when you go access care in the hospital, they give you a form, right? You sign the document. Now, this form is filled by the biller, right? Who fills the document based on what the doctor has done. Now, when the biller fills this document is sent to you as a hard copy. So you're going to literally hold the biro to keep searching what has been done, doing the mathematics, the addition, the subtraction, and all of that. So this is really cumbersome because as of then, you may have been dealing with just, say, maybe 500 enrollees and dealing with probably, say, 10, 15, 20 hospitals. But right now, we're dealing with over 2,000 hospitals. And then we're dealing with over 37,000 to 40,000 enrollees. So how do pen and paper do this job? It's not going to work. It's going to take a whole year to pay those bills. So technology, right, as a key driver here is such that now you have what we call, a created, a created hub. Now, this hub, which is created, right, of course, usually done by the IT experts. They know how to do all of that. So they create this hub, they create this system. Yes, they create this system such that everything is integrated on either an app or the sites. Now, once you have this, the hospital, right, can get across through this hub, right, through the portal. It's a portal now. Through the portal. Now, the enrollees also have their arm in that same portal where they can check their benefits. They can also get across to Life Action Plus, and then Life Action Plus also has this same portal. So every stakeholder has been integrated in this one portal.
Yeah.
Right? So integrated in this one portal, through that channel, we can communicate. Via mail, via the portal, and the likes of others. Now, what has this done, in recent times? Because I remember when the process started, we still had claims coming in, right, in form of paper hard copies, coming in. And this was a cumbersome process. It might take you about 2-3 months to process those claims. But right now, in just less than 30 days, 14 days, you can process your claims, right? Because of this integrated, tech system that has come to be. Now, again, we're also looking at a situation that is where we are present. That's where we are presently, what technology has been able to do in this system. Now, and you know that there's always a waiting time, which most people are not too comfortable with when you spend too long time in the hospital. Yes, because imagine you have to put a call across, then you put in a call and the network is hanging left, right, or center. So what do? You just send email to the port, send email or send messages to the portal by web communication. In less than 2 minutes, right, you get a response and that enrollee can get treated. So they spend about 15, 20 minutes in the hospital as against the 2 hours, 3 hours which people usually spend before. Now, going forward, what are we looking at here? We want to also now incorporate other systems like the pharmacy benefit system in the portal system, the laboratory system in the portal system, all in one, encompassing. Then at the same time, we now see how we can key in through the ICD, the ICD system, right? That's Center for Disease Control, how we can have key diagnosis there, and these diagnoses are now integrated to the system. So once you log into the system and you are not aligning to, the ICD diagnosis, it's not going to pick up those claims. Another system we're looking at here is not to relieve the claims officers of their job anyway, not to relieve the claims officers of their job anyway, but a system where the enrollees themselves can actually vet the claims. That's going to be beautiful. I mean, imagine if you're the one that has to vet the treatment that's been given to you. So that means that these claims can get to you. You are first authenticate and say, yes, this service was given to me before the claim gets to Life Action Plus. So this is what technology can do. So we are looking at this in the near future. So we're actually trying to map out 5 years, a 5 years, goal plan. And all of this is going to be involved in that 5 year goal plan. So we have a seamless process.
Interesting. Again, this is usually a debate, right? As to will AI and technology be taking people's jobs, and then the big question I tell people is, what if your business is scaling 10 times today? What would you do? Would you also be scaling your workforce 10 times when you could use technology, to enable same amount of people do 10x what they're already doing today? And, excitingly, that's, where Curacel comes in. How do we entirely automate this process, leverage artificial intelligence in, vetting these claims and just making everyone's lives easier? But I was going to ask, in terms of your direction now, we are in the rise of artificial intelligence today. What role do you see AI playing in this your, technology roadmap? How do you see artificial intelligence, improving your business today?
Oh, well, I mean, everyone knows what AI does. You just click and then AI gives you every information that you want,
Yeah.
through, of course, we see that in WhatsApp, we see that on Facebook and everywhere. So that tells us that there's a great role and a great deal that, can come into the business line when it has to do with AI. For instance, why would you want to use, 10 hours doing something that can be done in just 1 hour, 1/10 of the time, or that can be done in just 30 minutes? I mean, if you have to consider, people's job and all of that, then it means you're making a mistake because people are still going to work anyway. You still need humans.
Yeah.
Anyway, you need humans because people are still going to do what they have to do.
Yes.
So the role of AI in all of this is that we can have artificial intelligence, come to play, right? Such that the whole system, right, could be reviewed, whatever you have done to eliminate almost completely errors. Whatever you have done, you just put, indicators there in place. And once these indicators are in place, the AI checks these things for you. So one, you are sure, because imagine if you're going to be vetting, even though you are using the technological driven system, and you're still going to vet those claims. And for instance, you drop in a zero digit, you drop in a zero on, say, 1,000 naira. That becomes 10,000 naira, right? Yes, it is digital. However, human error dropping in that zero is going to put a negative on the invoice. So what role would AI play? It's simple. It goes through the whole system, right? It helps you to eliminate these negatives. It just brings up this alarm, right? There's an error pointed out here, right? I don't think AI is going to help you delete or correct that amount because AI may not know exactly what the amount is supposed to be.
Exactly.
So people's job is not still taken. So AI will just play a role to help to filter this. Not just, I think, let me drive a little away from the idea of just the claims. What about the data itself? I mean, the entire data for the organization. Yeah. That plays a role too. So you need an AI because sometimes computing these data are not easy. Mm-hmm. But with AI, you can get your data in split seconds. You have your data ready for whatever analysis you want to use them for. Yeah, whatever analysis you want to use them for, or whatever policy you'll be informed to make. AI will come and play a role there for you. So it cannot be overemphasized.
Lovely. Thank you very much, Dr. Uzezi. We're coming to the end of this episode, but before we go, if you had one key advice as of today for insurance professionals and operators, what would it be?
Oh, my advice would be, come on, be transparent. That would be my advice. Secondly, drive digital. Okay. I mean, technology wins it all.
All right, then. You heard it first from Dr. Uzezi. Be transparent, go digital. Technology is the way forward. Dr. Uzezi, if our community members want to find you, how can they reach you?
Oh, well, you can reach me through my LinkedIn, which I just sent the address. That's one. Secondly, right, you can also reach me through my email. I think I use the email to send a message across. And I got the feedback through the email. So you can also reach me through the email. Any of those two reach.
All right. Thank you very much. So, ladies and gentlemen, we will leave the contact details below. Feel free to reach out to Dr. Uzezi Akpotu and take the conversation forward. Thank you very much again for spending your time with us, sharing all those nuggets and insights. And I'm sure a lot of our community members will find this very valuable. And yeah, do not forget to hit the subscribe button. I'm Abdul-Jabbar Momo. Once again, thank you for staying tuned, and I'll see you in the next one. Cheers.